Hello, my name is Turkan Hüseyinova. I am a reapplicant for the Diagnostic Ultrasound program at Belvey College. I'll start talking about myself first, and then at the end of video I will be talking about the change since my last application. I am a medical doctor with more than 10 years of experience in digital ultrasound and sonography. I moved from Azerbaijan to the US 3 years ago with my family. Adjusting took some time, but even before coming here, I definitely knew that I want to work in the medical field as a long-term plan. It has always been my passion. Even when I was a child, I wanted to help people with medical conditions. Then my uncle passed away because of cancer. I had to cope with losing someone dear to me. This helped me decide to become a doctor myself, so I applied to the med school. When at medical school, I chose digital ultrasound and sonography as my focus track. After graduation, I started to work at a state hospital in the gynecology department as an MD specializing in diagnostic ultrasound. In Azerbaijan, you can be a diagnostic ultrasound professional only if you are an MD to practice that specialty. I performed different ultrasound examinations, including specific body parts such as the abdomen, pelvis, and the thyroid. Even as mother of two little boys, I continued taking different courses in pediatric neurosonography, and I started volunteering in the pediatric department, imaging a wide range of intracranial pathology in infants and newborns. When I moved to the US with my family, I found out that my medical degree and experience as an ultrasound professional would not count here. So I decided to study again to continue my dream of doing the same professional for a living. To get an experience in healthcare in the US, I started working at the physical therapy clinic. I helped patients who needed physical therapy to schedule their visit, coordinate their therapy plans with the doctor, also help with medical billing. Currently, I am working at the regenerative medicine clinic as an administrator doing general office work, medical records, and patient handling. As to the question about my experience working with sick or dying patients, I have had some sick or dying patients during my experience as a doctor back in Azerbaijan. As someone working in the healthcare field, you build the stamina to embrace these difficulties. Last year, I volunteered at the rehab and nursing center in Issaquah for females. I worked with patients that needed long-term and end-of-life care, nursing, social, and rehab services. I gained an experience to provide a compassionate care and attention, especially for elderly patients. I learned how to approach each patient with empathy, as most of them stayed there until they pass away and were fragile due to their advanced age or illness. Regarding the question about specialty areas of the sonography, there are three main areas of ultrasound testing. The most common of which is general sonography. It's used to look at major organs in the abdomen. Echocardiography specializes in ultrasound of the heart, and vascular sonography focuses on study of blood flow in the arteries and veins outside of the heart. Vascular exams are performed using both ultrasound imaging and Doppler flow analysis. All of these three different areas of sonography are similar in that they are using an ultrasound machine with high frequency sound waves to examine patients' organs. I love general ultrasound, which included obstetrics and abdomens, in which I have great experience and love. As I mentioned in the beginning of the video, I am a reapplicant for program this year. During this time, I have worked on my language and personal skills by spending more time with patients at work, and I took English 101 and currently enrolled in English 235 classes. I also got a certificate in laser science to treat skin damages, age spots, varicose veins, and other skin conditions. The ultrasound is definitely a challenging field. It's always changing. You see new pathology with each case. I especially enjoy and always get excited when I show babies in ultrasound to new parents. It's so emotionally rewarding but challenging at the same time because it's not always that you give good or exciting news. You have to able to bear bad news as well when patients are seriously sick. With my 10 years of experience as a medical doctor, I know how it is important to work as a team. I know what specific details doctors need to pay attention to. For me, sonography is almost like putting a puzzle together. If you know where to look for a problem, it makes it easier than more interesting. I love technology and computers, and I love helping people. If you mix this all, you have sonography. Thank you for your time.